for parents who are dealing with kids who have developmental delays or some kind of neurodegenerative disorders. They might want to know the answers to these questions. The first question is, which children are at highest risk for neurodevelopmental disorders? And how early can we spot the red flags?
Very good question, Ahmed. For example, the normal age of when the child comes into this world is 40 weeks. If a child comes early, the development which happens inside the mother is very fast, is very appropriate. But when the child comes early, those kids are under risk. So they can get sick, they can get infection, they can get developmental delays. And the kids who get some kind of issue at the time of delivery, whether they get less oxygen or they get some kind of trauma at the time of birth, these are the kids you got to take care, like they are at risk. And then the mother's health is very important. How did the pregnancy go? The If mother had gestational diabetes, if she had hypertension during pregnancy which was uncontrolled, that affects the baby. If the mother was taking some kind of medications which are not helpful for the baby, those are at risk. If mother takes some kind of drugs, they affect the baby. Some kind of infections, they can also affect the baby. And then there are certain things, for example, you can't control. For example, the kids have some kind of chromosomal issue, some kind of genetic issue. So it just happened by chance. But those are the kids need a little bit more care, they need more attention. And then when your child is growing, I want you to understand this very basic concept. We human beings are basically scripts. There's a
Hmm.
script written on a DNA which is predefined. As long as the child gets the proper nutrition, that script is going to unfold. It is already written that child is going to hold the neck at 1 month. He's going to smile at a certain age, 1 month of age. It is already that he's going to roll over by 3, 4 months. He's going to sit by 6, 7 months. He's going to crawl by 9 months. He's going to stand by 1 year. So this is all the script. These are the normal milestones. All the charts are already available everywhere. The teeth are going to come at a certain time, and then they're going to babble at a certain time. So if your child not meeting those milestones in time, then seek help, because there could be some kind of deficiency and you can get help and your child may just grow normal. The other thing is, if the child is not developing socially appropriate, he's not responsive to his name, or if he's not responsive to emotions, so that's also a sign